In this video, I am going to discuss about approach to a patient with suspected language disorder. If a patient is having a suspected language disorder, check for spontaneous speech output, whether it is non-fluent or fluent. If it is non-fluent, check for comprehension, whether it is good or impaired. If the comprehension is good, check for repetition, it is good or poor. If patient is having good repetition, it is transcortical motor aphasia. If the patient is having poor repetition, check for writing. If the patient is having aphasic writing, it is Broca's aphasia. If it is normal, then it is verbal apraxia. If the patient is having non-fluent aphasia with impaired comprehension, check for repetition. If it is good, it is mixed transcortical aphasia. If it is impaired, it is global aphasia. If the patient is having fluent aphasia, check for comprehension. If it is good or poor. If it is good, check for repetition, whether it is good repetition with only impaired naming, it is anomic aphasia. If the repetition is poor, it is conduction aphasia. If the patient is having fluent aphasia with poor comprehension, check for repetition. If it is good repetition, it is sensory transcortical aphasia. If it is poor repetition, it is Wernicke's aphasia. Thank you.